talk about our rotator cuff protocols. We're going to talk about phase 1, which is our sling phase, our rest phase, or our max protection phase. Phase 1 happens from weeks 0 to week 6 for the most part. If you have a massive rotator cuff repair or an extended time in your sling, you may wear your sling for 8 weeks. And if you're on the accelerated program, you may only wear your sling for 4 weeks. So here's what your sling will look like. You've got an abduction pillow, which keeps your arm away from your body, allowing your shoulder to rest. Your elbow should be deep in the backside, and your arm should be parallel to the ground. So now we're going to remove the sling and perform the basic exercises that you'll be doing in phase 1 of your therapy. Relax your shoulder. Okay, go ahead and stand on up. Relax this arm the whole time, bend forward. And just relax this arm. Left hand's going to guide the abduction pillow off the arm and stay relaxed. Good. And stand up tall. Good. Relax your arm. Relax it. Good. Over phase 1 of your rotator cuff repair protocol exercises. We have 5 major exercises that we're going to be going over today. First, we're going to be turning to the side here. We're going to be pinching your shoulder blades back. Go ahead and pinch back and relax. 1, we're going to do that 5 to 10 times. 2, 3, good. Only thing that's moving are the shoulder blades. 4, last one, 5. Good. Kendra, face me. Next, we're going to have the left arm grab underneath the right. Relax that right arm the whole time. Left hand pushes your right arm to your tolerance into the neutral position, and we'll bend it up and down. 1, we're going to do that 5 to 10 times. And again, these exercises would be done 3 to 5 times a day to your tolerance. 4, we'll call it 1 more. 5, go ahead and relax. Relax the arm by your side. We're going to do hand squeezes 5 to 10 times. Just get that blood flow going. Should feel good to get your arm out of the sling. And of course, we never want pain to occur with any of these exercises. It should feel good to kind of get it moving. Good. All right, next we're going to go up to your neck. Remember that sling is kind of holding up your right arm, so there's a lot of pressure on your neck throughout the day, so it'll feel good to kind of side bend your head away. Just kind of feel it stretch and relax. Good. 1, you would never use your surgical arm to grab your head and pull your head from side to side. You can use your opposite hand to pull your head if you were to pull this way. Good, and relax. You could use your left hand to push your head away. Good. Or you can just move your head side to side independent of your arm. Good. So next we're going to do the pendulum exercise. So we're going to turn to your side here with your left hand on the table, left leg forward, right leg back. We're going to bend forward. Remember, relax this arm the whole time, let it fall. So gravity is bending the arm down. Good. So she's kind of standing up almost parallel to the ground, relaxing that arm. She can pump her hand while she's here. This is also a great position that your left arm now can come around and clean your arm in the shower. This is a position you put your clothes on and off and thread your right arm in and out of clothes. Okay? After the first week is over of your healing and you want to get this arm moving a little bit, you can rock your body front to back. Now just relax this arm, Kendra. Rock your body gently front to back, and if that arm moves in relation to your body, that's fine. This is a pendulum. So there's your front to back. Now Kendra, spread your right leg next to your left. Good. We can also go side to side here. Relax your arm. Let momentum swing it. Good. Side to side. Good. And then you can also do circles. Good. Just let your arm, try to use your body to give momentum to your arm. So let your body move a little bit. Just kind of move in a circular format. Good. And then the other way. 5 or 10 times. Okay, up tall. Perfect, and relax. All right, so now we're going to be putting your sling back on and getting back into that rest position, that position that is comfortable and a position that should keep you protected in the event something happens. Okay, so with your always relax your right arm. Remember, we're going to be coming to your right arm. Your right arm doesn't want to go to anything. So with your left hand, grab that abduction pillow. I want you to bend over, drop that sling down. Good. Relax this arm and let it fall into the sling. Thumb on top of the handpiece. Put it on your hip like a toddler. Good. Okay, next we're going to grab the neck piece. We're going to bring it up over your head. Good. Okay. And the caregiver can help, or the patient can help themselves. Next, you got to do what we call the Sling Swing. Grab this piece here, go ahead and put it around, engage it in. Good. So relax that shoulder. Good. And just go ahead and face here. So we've got Kendra now relaxed in her sling. Her elbow is in the back of the sling. She's well supported. It's on her side. Her neck is holding up the sling there.